Hello, and welcome to episode 124 of Public Interest Podcast with your host, Jordan Cooper, where we interview politicians, activists, advocates, and others who seek to improve the state of the world. We're here today with Dan Mendelson, CEO of Avalere Health, former Associate Director of Health at the White House Office of Management and Budget. He is currently an executive in residence at the Fuqua School of Business at Duke University. He's a former board member of Coventry Healthcare, Pharmerica Corporation, and HMS Holdings. Dan, thank you so much for joining us. How are you doing today?
It's my pleasure to be here. I'm doing just fine.
Excellent. The first question I'd like to pose to you is, what are you currently doing, or what have you ever done to advance the public interest, and why?
Wow. So, Jordan, I would say that much of what I do is focused on that intersection of public policy and commercial strategy for healthcare organizations. And it's my view that in our healthcare system, that it's really important for companies to have a deep understanding of government, federal government and states, the needs of government, and a clear understanding of government programs, and that by furthering an understanding of government programs, as well as furthering an understanding by public officials about how the commercial sector works, that does advance the thinking as well as patient care.
So you first were working in the White House, you've worked in the public sector for quite a bit of time, and then you ended up transitioning into starting your own business to really kind of present the commercial implications of public policy. How was it that it occurred to you to go through that transition?
Well, I mean, for starters, I did have a background in advisory services before going into the White House. So I had worked at the Lewin Group and was very close with Larry Lewin and Bob Rubin, who at that time was the operator. Not the same Treasury Secretary Bob Rubin, the former Assistant Secretary of Planning and Evaluation in the Reagan administration, who's a lovely guy, physician endocrinologist. He should be on your list of people to interview at some point. But in any case, I had done advisory services, and it really was in my mind. And when 2 great years in the White House working with Bill Clinton, and then when I left, I wanted to be in a place that was deeply connected with public policy. I wanted to be in a place that was commercially operating, if you will, and a place where there was no advocacy going on, no lobbying. And I looked around carefully, and it didn't exist, and that was really what stimulated me to start the company in 2000.
So why carve out lobbying? That's obviously a big role of many organizations in the Washington, D.C. area. Why avoid advocacy?
That's a decision that everyone gets to make for themselves. And I carved it out because I felt that being in government, I was occupying a seat. I felt like I had essentially been delegated the public trust, and that going in to advocate on the back end was not the right thing to do for me. And then I'll say one other thing, which is that I'm an analyst, and I'm very analytically focused, and that's the way my brain works. And while I enjoy communicating, and in fact communication does have an aspect in the Avalere mission, it was not really what I wanted to do. It wasn't the focus of what I wanted to do.
So there's a lot of individuals who also have an analytical brain and don't. It's a big step to go out and be an entrepreneur and say, instead of applying to be an analyst at this organization, that organization, I'm sure you had many opportunities to go out on a limb and say, I'm going to start my own thing. How does someone go about being an entrepreneur, going from that level position to really just saying, look, I can do this better on my own?
For me, it was just about having a clear vision about what I wanted to do and how I wanted to position the organization. And so I think it's important to have clarity as to what you want to accomplish and to carry that vision through. And then it's also a matter in the advisory services business of having enough people skills so that you can find great people. They will want to work with you. You can treat them really well, and by that, you kind of grow the organization.
So let's back up to the beginning.
That's greatly oversimplified.
I mean, consulting can be many different things. So let's back up to the beginning. Were you always interested in healthcare? How did you get involved in How did you begin walking down this path?
My dad is a physician, he's a cardiologist, and
that didn't scare you away from medicine?
No, in fact, I mean, it's there was a lot of dinner table talk about cardiology. It's like there were basically two subjects of conversation growing up. One was Judaism, and the other was cardiology. So that was a major focus for all of us.
Were you thinking of going to medical school?
I never did. I was not science oriented. I actually spent a lot of my time growing up playing music. So I played viola and violin and did my undergraduate work there, and in fact played professionally for a couple of years before I moved into the health policy space.
Interesting. Where did you play with a Philharmonic? Or?
I did. I moved to Boston to study with a truly exceptional musician named George Nykrug, who was then teaching at New England Conservatory, and I studied with him and also played with a lot of the freelance orchestras in Boston, North Shore and South Shore Philharmonic, the Worcester Philharmonic. I subbed with the Boston Pops and then also did some rock and roll studio work as well as on the RCA label.
I can see you smiling. It sounds like you had a lot of fun.
Yeah, those were great years.
I mean, so what, do you still play?
I do. I still play.
Yeah, and go out. Did you have a band?
Or
chamber music?
When I stopped playing classical music, I now play klezmer, Jewish and Eastern European folk music, and I enjoy that very much. So it's a hobby.
Interesting. Yeah. What kind of venues do you play in?
Not much these days.
A little bit.
It gets less and less every year, Jordan.
Plate, right?
Exactly.
So, all right. So you're doing some klezmer music, and then I guess clearly you still enjoy it. Why did you ever decide to leave and go into healthcare?
It was the realization that I came to actually after I left Conservatory of Music, that I went into music because I valued self-expression, and my talent level, I wasn't great. I was good, but I wasn't great. And my talent level was enough to really be a good orchestra player. But in an orchestra, the string players that are most successful are the ones who do exactly what the conductor is telling them to do. And that's not me. I've always had kind of an independent streak, and I like to think for myself and do what I want to do. So when I came to that realization, it was clear that was not. And there wasn't a lot of business in the rock and roll studio work. And in fact, actually, with the advent of synthesizers, there's even less today.
So it sounds like you were really about interpreting the music in your own way,
I would say,
and expressing yourself through that music, and in fact that isn't what the conductor wanted. So you ended up going in healthcare, and have you been able to find means of self-expression? I mean, clearly creating a company is somewhat of a means of self-expression.
Yeah, look, I love what I do. I love the people. I love the focus, and I'll say also that I feel that as a group, as a collective, Avalere has had a significant impact on the policy process and helped to improve mutual understanding between corporate America and the policy process, which is really the goal. So
let's start with policy and then go to corporate America in a moment. You've been in the upper echelons of government. Can you speak about, compare and contrast the influence that you had on the public policy process while within OMB versus here in the private sector, attempting to influence what's going on in Congress and the White House?
OMB is an incredible place. I mean, the quality of the talent there, the ability to focus on the broad portfolio of healthcare issues. I mean, it's a phenomenal place. And I'd say that the beauty of acting in that environment is that you have access to HHS and the Justice Department and the VA Health and really all of those different areas. And so if you come in with an idea about something that you want to do, it's possible to do it from there. I mean, being in government is always being collaborative. You know, there's the White House, the Vice President's office at the time was strong and good, and I'm very proud of what we accomplished in the latter part of the Clinton administration. We insured 10 million kids under the Children's Health Insurance Program. We brought hospital costs under control through the Balanced Budget Act policy. We wrote initial drafts of the Medicare drug benefit that subsequently were used as models when the Republican Congress passed that.
Medicare Modernization Act of 2003.
Yeah, exactly.
I guess what I was trying to go for is I heard someone, I'm not sure it was entirely correct, but I heard Bill Clinton once said that one day that he spent in the White House, he had greater influence in that one day than he has had in years at the head of the Clinton Global Initiative foundation. I guess so. Like, does that also ring true for you? Were you able to have a greater impact in such a short amount, in a smaller amount of time in the White House than you are in the private sector on the outside looking in?
I think that's probably true if you're the president of the United States, but not if you're running OMB Health.
Okay.
I mean, running OMB Health is a very collaborative exercise, and you work with the HHS secretary and with the head of OMB and with Congress, and you are a person who's getting things done. And look, I'm very proud also that we dramatically expanded funding for healthcare for Native Americans during that time. We expanded funding in the NIH, and we did it in the context of a balanced budget. So I'm very proud of what we were able to accomplish during those years. Big things. And
a lot of equity, expansion of access.
Yeah. Well, ensuring 10 million kids was a good place to start.
Yeah. So now you will move back on the corporate side.
Yeah. You're
advising your corporate clients basically how to deal with the business implications of public policy decisions, correct?
Yeah, we do that. So, kind of one other thing to introduce into the conversation is that I ran OMB. I ran Avalere as a standalone for many years, and then about a year and a half ago, I merged it into a very exciting and innovative public company called Inovalon. And Inovalon is in the healthcare data space. And strategically, the reason why we decided to merge two organizations together was that there was a real congruence of the missions and an ability to take a lot of the advice that we were giving and a lot of the collaborative work that we were doing and bring it into the operational context. So, for example, we have for many, many years focused on the problem that when a patient is discharged from the hospital, there is really no rationality to where that patient goes after they're discharged.
It could be based upon any kind of existing referral patterns or who knows what.
A lot of different things. And so we've been focusing on that for a really long time. With the new ownership status of Avalere being part of Inovalon, we're actually now creating algorithms and platforms to execute on that issue. So
for our listeners who don't know, why might it matter where someone goes after a discharge? Because most people may think, well, if I'm being discharged from the hospital, then I'm all good. I'm done. I'm better. I'm healed. I'm healthy.
Right.
But could you talk? Is there readmissions or different?
Right, Jordan, that's a young person's view of things. So after you've had your hip replacement, you're not all good. You have to recover.
You have rehab?
Yeah, you might have rehab. You do have rehab, and you have to figure out a safe place to be. And, for an older individual, it's often the case that going home is not the right place, at either a skilled nursing facility, a rehab facility, or going home with home care. So the question becomes, how do you figure out what the best place is for the patient, what will optimize on quality, and then also what will be cost effective for the healthcare system? So this is a policy problem that's been bubbling around for a really long time. The exciting thing about our new arrangement is that we are creating systems to fix this problem, and that's really cool. Because government can be very concerned about a problem, but unless government has a mechanism through which to fix the problem doesn't get solved.
Now, we're talking about government a lot, but in a lot of parts of the country, 1/3 of Americans are covered by Blue Cross Blue Shield organizations. There's a lot of different private payers out there, and a lot of their decisions about what to cover is what drives the process for healthcare decision making for a lot of different Americans.
Right.
It's not all just Medicare and Medicaid, which would be federal government programs. So we're talking a lot about government. A lot of these different organizations are your clients, correct?
Yeah. Look, many Blue Cross Blue Shield organizations do provide services for the government under Medicare Advantage and Medicaid programs. So we live in a really symbiotic environment. The other point that I'll make is that innovations that happen in government get exported to the private sector. Innovations from the private sector get imported into government, and so it's very fluid. And that's frankly what I'm really most interested in and most focused on in my work here, and really have been in my career, which is that if you improve the understanding and the ability to operate across those two environments, you ultimately further human health. And if you have a situation where government doesn't understand the private sector and private sector doesn't understand government, you've got a problem.
So you're kind of an ombudsman or a translator in a way.
Yeah, I would say that what we do is enable that partnership to be successful. So it's not so much about observing it. We are active participants in making that partnership successful from a substantive standpoint.
So let's say you have a client, and this client offers a Medicare Part C, which for our listeners, as Dan just mentioned, is a managed care plan for Medicare. Mm-hmm. So this organization is going to say, oh, well, I know you guys use big data, and we want to, what do we want from you? What are you going to be able to do for us?
Well, we do a lot of different things for Medicare Advantage plans. Mm-hmm. We help them optimize their quality measures. So Medicare Advantage plans are very focused on quality. A, because it's the right thing to do, and B, because that's one of the ways that they get paid by the federal government.
So there's cost shifting and also a desire to avoid the managed care backlash of the 90s, where there wasn't as much an emphasis on quality, more it was just an emphasis on cutting costs.
So we help them improve quality, and that's a major focus for the organization. And plans today are focused not only on the quality measures that the government is asking them to focus on, they're also very focused on things like post-acute care, just what we were talking about before.
For our listeners, post-acute would be after the hospital.
Exactly, and so it's the care that happens once the patient is discharged, skilled nursing facility, rehab. I appreciate your correcting me on my on my
elucidating,
code.
Not
exactly.
corrected.
Well, yes, exactly. Expanding, but and then plans are also very focused right now on how to integrate medication into the care pathway, into the care of patients. And so, how do they think about lowering cholesterol on a population basis, and what's the most cost-effective way to achieve the optimal outcome? And those are a lot of the things that we focus on.
So as government policy decisions are moving in a direction of population health management, moving away from fee-for-service, which for our listeners means paying doctors or hospitals money for everything that they do, more towards paying a bundle or global payment, which is take care of this person per member per month payments, things of that nature. So as we shift to population health, these private hospitals, healthcare delivery systems, payers are saying, well, we have this responsibility for all this population. How do we keep them healthy without overspending our budget? And so you're helping them deal with the implications.
Yeah. So strategically, this is really the focus of Avalere today, in partnership with Inovalon, and will be our focus over the next 5 years, which is facilitating that shift from pay for volume to pay for value.
And so that could
be very important. I mean, and you want that as a patient. You want to know that the plan and the payer are ultimately thinking about improving your health, as opposed to just paying when you go to the doctor.
And improving your health with this new payment model could actually be more profitable for these private organizations. If I give beta blockers to people who are at risk for heart attacks and I reduce the incidence of heart attacks, then therefore I have to pay for fewer people to go to the hospital. Or if I am able to improve other healthcare metrics, I'm basically able to save money in the long term for me, prevent readmissions, and make my population healthier, which is good for the patients, but also good for my bottom line, and reduce unnecessary tests. It may be that I'm getting too many CT scans, and it's also hurting the patient, but it's costing me money. And so I'm willing to pay Avalere and Inovalon to save me that money, so I can make even bigger savings in the long run. Is that right?
That's well put. And I would say that, again, we are focusing, at Avalere, we're focusing on those areas that will most improve the healthcare system.
Sure.
So that it will not only improve human health, but also the effective function of government and private plans.
There's so many areas of the world in need of help. There's saving the whales to climate change. How are you so passionate about healthcare in particular? Obviously, this is the path your career has taken, but it seems like you also have a real desire to improve not just healthcare delivery, but really the health of Americans. Why is that?
I can't really tell you that. Look, it is a passion. It's what I've focused on, and I do think that there's a kind of a pathway to all of our careers, and that you end up focusing on something and really getting into it in a way that is meaningful. But it's in my family. It's something that I care really deeply about. There are other things that I care deeply about as well, though. So it's certainly not the only thing.
So as we approach, before we go any, do you have any siblings?
Yeah, I do. I have two brothers.
And are they both in healthcare, or either of them in healthcare?
Neither are. Yeah.
You were saying that healthcare is in the family. What are they involved in?
So I have one brother who is living in the DC metro area, who is a software engineer.
Interesting.
And,
well, that's kind of related to what you're doing with big data and algorithms.
It's great work. He does a lot of work on kind of making organizations more efficient.
Yeah.
And then my other brother lives in the Bay Area in Oakland and is an architect.
Okay, so there is a family influence, but you're the apple that fell closest to the tree with your dad's cardiac practice. So, okay, and then just one more thing on the you're also a professor.
I teach. I kind of resist the label, the professor label, because like my students will call me professor, and I'll look around the room to see who they're talking about because I don't kind of see myself that way. But yes, I love teaching. I do.
Interesting, because you've taught at different schools. So why is it that you teach? What is it about teaching that you enjoy?
I enjoy the engagement and the interaction with students, and I enjoy also bringing the content that we work so hard at Avalere to produce into that environment, and it's fun. So
how do they
stimulating.
react?
They're very my students over the years have been very, very interested in understanding that relationship between business, operational improvement, and the government, and that again is the area of content that. So I teach in a business school, and I think it's really important for students who are in business school to understand about how that relationship between businesses and the government operates, because again, it's healthcare is a very regulatory environment.
So really, there's a lot of private sector driving public sector developments, but then also a lot of public sector developments driving private sector business decisions.
So teaching has always been a small component of what I do, and I like it that way. My good friend Kevin Schulman, who started the healthcare program at Duke in the business school, used to say that he was delivering to me all the best of academia and sheltering me from all the worst of it. The best of it being like the engagement with the students, the fun parts, and the worst of it being the
politics of being in academia.
Exactly. So I always appreciated that.
So as we approach the end of this podcast, I'd like to ask you a final question. I like to imagine that you're speaking to a student in your business school. And I'd like to ask you to tell the student, a little bit about really what he or she ought to do throughout the course of his career, and what you've attempted to do in terms of what legacy you believe you're leaving in society through all of your work. What has been the core motivation? Why has it been important to you to improve other people's health? Why advance the public interest? And then what do you hope at the end of the day will be your legacy of your career?
There's a lot of questions in there, Jordan. All right, so first, the easy one is kind of the engaging with students, and this is something that I love doing, and I would say my best advice is to be inquisitive, to be thoughtful, to listen, and to really get into a place in business or in government or wherever you go in your career where you can learn a lot and really help others. And so to me, mentorship is very much of a two-way street. It's not just an experienced person helping a junior person along. It's about mutual contributions. And when folks leave school and they come into the workforce, the important thing to understand is that the more you give, the more you get. And then I think it's also really important to just treat others with dignity and respect, because and that's something that perhaps is obvious, but it's a small group of people, and I also think that by treating others really well, that it just creates the world is a better place. And then the fact is also that you will find all of these same people in your career every year, and it keeps coming around. And then with respect to the kind of the broader the broader piece, look, I am very proud of the accomplishments of our organization to date, and will relate this in some respects back to the Avalere mission, which is to be the essential voice improving healthcare. And we do that today, and I think it's really a matter of improving healthcare by bringing operational improvements to the market. And I'm very excited about the future of this organization, and that's definitely something that continues on. And then, on a personal aspect, I'd say also that it is gratifying to see those changes come and to see mutual understanding grow between our clients as well as public officials.
So that has been Dan Mendelson, CEO of Avalere Health, former Associate Director for Health at the White House Office of Management and Budget, the Executive in Residence at the Fuqua School of Business at Duke University, and a former board member of Coventry Healthcare, Pharmerica Corporation, and HMS Holdings, who speaks about dignity and respect being primary values that have driven him through his career in public service. He speaks about being a facilitator for mutual understanding, where between healthcare and between private sector, as an entrepreneur, as somebody who is involved in big data, he as we say in Washington, wears so many different hats. He has so many different identities.
They're just falling off my head.
He has been a professional viola player in a philharmonic. A professional musician. He's a teacher. He's an entrepreneur. He is a analyst, as he says. But what does it mean to have all these different identities? For Dan, public service is about making connections for people and creating solutions. Dan is a man of bridges. In fact, if there was an architectural edifice that might represent Dan, it's a bridge. He's somebody who makes connections for people. He makes solutions. Public service is something for Dan that's important. He cares so much about other people's health and improving quality of healthcare. And frankly, the way that he makes good business decisions, it sounds like, is what is in the interest of the public, and that ultimately will be in the best interest of your company or your government agency. So, Dan, I'd like to thank you for your time with us today.
My pleasure. Thank you for saying those nice things.
And this is, for our listeners, this has been episode 124 of Public Interest Podcast with your host, Jordan Cooper, where we interview politicians, activists, advocates, and others who seek to improve the state of the world. Remember to subscribe at publicinterestpodcast.com, listen on iTunes or your podcast app on Apple products, and should you wish to communicate with Dan, you can leave him a voicemail. The phone number is on the Contact Us tab of the website. Thank you so much for joining us, and we will talk to you next time.